Good evening and welcome to Psychedelic Healing. I am your host, Sonia Cotto, nurse anesthesiologist and mental health advocate, here to discuss psychedelic healing. Tonight, my guest, Dr. Mauricio Consalter, is a Chicago-based internal medicine doctor and founder of Medici Healthcare, a compassionate medical practice established in 1999. Since 2015, he has been at the forefront of the medical cannabis movement in Illinois, certifying patients for the program and advocating for cannabis as a safe and effective alternative and complementary medicine. Witnessing reductions in opioid and benzodiazepine use among patients on a regular cannabis protocol, he has dedicated his career to expanding access to this potentially life-saving medicine. His expertise lies in identifying specific cannabis strains tailored to effectively treat various conditions. And currently, he collaborates with the Brazilian Congress, contributing to the creation of a medical cannabis program down in Brazil. In 2020, he expanded his therapeutic modalities with NeuroMedici, a wellness center to include ketamine-assisted therapy, along with cannabis-based internal medicine, a groundbreaking approach to mental health and chronic pain. Dr. Consalter continues to push boundaries in healthcare, striving to improve lives through innovative and holistic approaches. Welcome, Dr. Consalter.
Thank you. Thank you very much.
You're welcome.
Approach. Yeah.
Oh, yes. I see you drove right in when they started legalizing in Illinois with the cannabis and expanding that care. Have you always been known the medical benefits of cannabis, or was that just kind of discovered later on?
Well, I was watching the wave that was coming out of the West. It was kind of skeptical in the beginning, but I had a directorship, in a hospice care here in Illinois, in Cook County, Vitas Hospice, which I worked for about probably 3 years as a consultant, and used to see patients, back in 2010, 2012, and then we are noticing more and more patients were using cannabis for terminal conditions, were having, better energy, better appetite, less anxiety, and actually they were living longer than the guys were not using it, So when the program came in 2015, I started with cancer patients, and that was the first thing I did, until one day a doctor with cancer, stage 4 lung cancer, came to me and told me his story with the Rick Simpson oil actually was shrinking his tumors. Okay, he had metastatic disease to his pericardium. Okay, so which means the doctor will give you like 3 months for you, which means like 3 days or 3 weeks, you're done. Right? I mean, because your heart will stop at one point, and there will be pericardial effusion, cancerous, and boom. And the heart cannot expand anymore. And I said, the first thing came to my mind, I said, well, this is kind of crazy. And then we went through his CT scans, 3 months, 6 months, a year, and he was alive for 4 years,
And this was with Rick Simpson's oil.
With RSO, highly dosed RSO, on and off, he did like 3 months, go slower, and then come back on it. And, the doctors initially, they refused to do the chemo radiation. And then when they saw it, and they said, wow, everybody was impressed, Yeah. So, and then, of course, and then it came rheumatoid arthritis, came all sorts of autoimmune disorders, including lupus, multiple sclerosis, Crohn's, ulcerative colitis. And that's what I see the biggest benefits right now. It's the autoimmune disorders, fibromyalgia, including, and obviously chronic pain,
Because all of these are all chronic inflammatory, diseases.
Yeah, and then exactly. And then, I tell people, say, how can I understand the whole process? What can I do? How a drug that controls pain, controls seizures, and give more appetite for cancer? And then the answer is very simple. You got to read what is the endocannabinoid system and how does it work, your receptors. And then when your endocannabinoid system starts going down, that's when your arthritis kicks in, your IBS, your migraines, and That's when you need the phytocannabinoids, and that's from the plant. Obviously, I'm very curious to know what's going to happen with our patient population for Alzheimer's disease. I think we have a good feeling about it. As you know, Alzheimer's is a disruption of the architecture of the brain, basically, with the positive, chronic proteinaceous materials that you should not be in your bloodstreams get deposited there. But more than that, not only that, you have the beta amyloid deposition. You do have chronic inflammation of your glial cells, which is the fat cell that covers the brain and feeds the neurons. So you do have CB1 receptors there, and then if you keep this chronic inflammation of the brain down, you might have something very extraordinary in the future, to discuss. I can tell you what, if you ever had any patients with post-concussion syndrome, chronic traumatic encephalopathy, you park the disease. You totally park the disease, then you see improvement,
Yeah. And then for our listeners, I just want to backtrack a little bit because I know some of them might not be familiar with the endocannabinoids. Everybody's familiar with cannabis and everyone's excited with the legalization, but there is healing aspects to it. We do have an endocannabinoid system that people don't understand, that we make our own cannabinoids. And now we have cannabis, and it's shown and scientifically shown that this cannabis and the CBD and the THC all have activity to stop the path of whatever overactivity, like the seizures, the chronic pain, the inflammatory, the autoimmune, all these disease processes. So, when we're talking right now about the endocannabinoid system, being able to stop this inflammatory pathway, you're treating arthritis and the fibromyalgia and all these autoimmune that people are taking these chronic steroids for. We just need to stop the path of the inflammation, not destroy the immune system,
Exactly. Your immune system does have receptors too, okay? You do have CB1, CB2 receptors, your immune systems in your T cell and your B cell, and then you see that on patients with chronic leukemia, the numbers start going down. But more than that, you avoid what happened like what happened, people describe that very well during COVID, which was the cytokine storm, which is your immune system going out of control, correct? And attacking your lungs, your kidneys, your liver. Marijuana chill out your immune response, period, And it's not only anti-inflammatory, it's also antioxidant, which no medication, no prednisone, no Motrin, no Tylenol can do that,
Yeah.
And if you notice, there were studies saying, that actually in animal model, cannabis had a good effect on the lungs for rats with COVID, But I saw patients of mine calling me. It's like, doctor, I got COVID and what should I do? And they said, what do you feel? I said, I have a slight fever and my lungs are fine. And I tell them, said, listen, get your CBD, do some THC together, chill out, relax, call me later if you need me. Get your vitamin D, your vitamin C as well, your zinc, But it was very, very rewarding to see the population. Obviously, during the pandemic, there was a storm of cytokines, but there was a brainstorm on everybody in terms of anxiety, insomnia, PTSD. People went out of control,
Yeah, it was horrible. A little beyond what cannabis can work on. And that's actually the same year that you opened your ketamine clinic is the same year I opened mine during COVID in 2020. How was that for you?
And was, financially was very hard because, people didn't have the education and we couldn't do anything about it,
Yeah.
We did have the patients and we did have to help a lot of patients, actually, to be very honest, because it's an expensive treatment and there were people coming to you in a desperate situations. You just, I did what I could do, But what I felt about ketamine it's a radical treatment for mental health. It's unbelievable results, and the speed of the results are very encouraging, And that's why, the whole thing about ketamine, you need two things. You need dissociation Okay, people have to feel themselves outside their bodies. They have to be prepared for that because psychedelic therapy can be very spiritual, and not a lot of people are ready to realize. I mean, a lot of people thought they were dying, actually, during the case. So you need to prepare, and then you develop what we call neuroplasticity. You develop new pathways in your brain cells, in your...
Yeah, within the first 48 hours, so important.
But during that period, the people needs to have a therapist, reintegration, and so on. You know what I mean?
Yeah. Beautiful. I love that. That was going to be my next question. So about what do you do for integration? Because that's what I've been noticing with a lot of clinics. Ketamine clinics are popping up all over, which to me, the more the merrier, because everyone needs this There's so many people that need this treatment. However, now you are seeing the disparities from clinic to clinic because the important is integration.
We need to create a system that everybody will have benefits, and I think it's coming. But it's it's very interesting that integration is very different from patient to patient. Most of the people, they like to go back to the therapist, but there's people who like to play a piano, the other ones to speak another language, and a lot of people just want to do yoga or massage therapy. It works, it's a different set. It's a much more complex environment, the psychedelic, than the cannabis, because there's way more receptors involved. But one thing I need to tell you that is very interesting that you're going to see in research, that the CB1, CB2 receptors, they stimulate the serotonin expression. So when you're using cannabis, your serotonin, the 5-HT3 receptors, they're enhanced, okay? So you're going to tell people, some people might just come to you and say, doctor, I did 250 milligrams of a mushroom, a microdose, and I used cannabis, and then they went on a big trip, or they felt really good. They work in conjunction. It's very interesting,
They enhance each other.
Yeah.
Okay.
And then, honestly, even ketamine, that we don't understand fully how does it work, in terms of
all the activities and where it works and everything.
There's probably receptors that we haven't identified yet, And the same is for DMT, I mean, we produce our own DMT, When you talk to a monk or a marathon runner or even a racing car driver, and they will tell you that after 2 or 3 hours, they feel their body getting out of the car, or the monks, they say, because they go in periods, they only sleep 2 or 3 hours a night. They eat very little, so they starve, they insomniacs, and at one point, they start leaving their bodies. They just go pray somewhere else. That's all DMT, The same for septic people with heart attacks, intensive care unit. You hear that. I had a near-death experience. I met my mom, I met my grandma, and that's all DMT, which is beautiful,
Wow. That's so interesting. Somebody did tell me that near death, that's what they're describing is, do they check the levels? Has that been studied and shown?
No, I don't think, listen, it's DMT studies right now. It's so rudimentary. So it's like it's in the Stone Age right now. But that's going to be the game changer for mental health in the world. You understand, we are living a mental health crisis right now. We don't have enough psychiatrists. We don't have enough therapists. We don't have enough nurse practitioners or PAs doing mental health, I just read an article in New York Times yesterday. They're using, in West Africa, in Ghana, Guinea, they're using hairdressers as mental health professionals. They don't have access. So they're training the hairdressers to do it. And then that was reading an article, and the Americans have the same too,
Oh, the providers, it's so difficult to find.
Hairdresser, you go to a hair salon, your lady taking care of you will be your mental health provider. It's crazy.
I mean, they have had lots of conversations. I think they might be good listeners.
Oh yeah, I think exactly. Just the right tutorials, they'll get there.
But even here in the United States, I mean, you as an internal medicine, physician, you provide mental health care.
There's, be fair, as you go through life, we are one package, and then you're barely going to see a patient who has chronic pain, moderate to severe, who's not about depression. There's no way around. Depression, anxiety, bipolar, PTSD, they come with chronic illness, it's there,
Yeah.
So you won't see a mental health patient with physical symptoms either, chronic. They come hand in hand. So
Yes.
well, when we went to medical school, we don't learn that, correct?
No, we're all learning it now. We learn
science by systems. And then we learned something called evidence-based medicine. Okay, and then my argument is the following: who paid for the evidence and where the money came from? It's either two sources: NIH, which is federal government, or big pharma. So that's how we learn.
Yeah.
So when
it's all biased.
Psychedelics, cannabis with patients, and then a lot of professionals don't they think we're nuts, out of hand. You know what I mean? But I would tell you what, I don't have one new patient on Norco or Oxy in the last 7 years in my life. I have 4, 5 actually, and that's it. I know.
Wow.
And we decrease a lot of the use of those opioids. So I'm pretty proud, of what we did.
Oh, you should be, yeah.
For the results, for the patients, and
how do you help patients wean off? Because I know with the benzos, how are you best? Is it a specific type of cannabis that you utilize with addiction versus?
I'm using a lot currently indicas with CBN. I'm using a lot of CBN. Okay, some addictions they have you have to go straight to ketamine, before you introduce the marijuana,
Okay.
And that's for cocaine and heavy alcohol, all that stuff, But usually, the patients, they come to you and they will tell you, I'm decreasing, I'm out. I think the success rate I'm having right now for chronic pain users is about 30 to 40%, which is excellent, okay?
That is amazing.
But
30 to
70% of those will tell you, I'm not taking 4 oxy a day, I'm taking 2, I'm taking 1, or I'm taking every other day, and if they stick to the plan, they'll be fine, So what we cannot do is just throw the patient out there in the street and let him do whatever he wants or whatever he can get his hands on. And that's how the guys were dying of fentanyl overdose, because they go to the street, they go look for drugs, and the drugs out there are laced. I had a kid overdose with laced marijuana in Peoria. He overdosed.
I don't even understand why it's being laced.
I know, it's unbelievable.
It makes no sense to me.
The same. Exactly, because even if you're thinking on the drug dealer perspective, he's losing his client. That's the funnel.
Yeah. Well, and that's why I'm so glad that the cannabis industry has advanced into the medical realm, and then the doctors like you are really understanding the specific strains to utilize, one versus, with anxiety, depression versus migraines, fibromyalgia, the autoimmune addiction, just coming off of certain benzos and opiates. Being able to utilize cannabis allows the tapering. Have you noticed tapering off of those, assisting patients to taper off those medications is a little bit?
Several with SSRIs, SNRIs, several. Sertraline, Lexapro.
Tapering off of those helps as well?
Yeah.
Wow.
Huge. And then benzodiazepines. Benzos is one of the worst addictions that I've seen in my life, from patients, and I've seen that improving. I've seen people decreasing the amount of neurostimulants as well, the Adderall, Ritalines of the world. And in polypharmacy, if you see what happens to your hemoglobin A1C, okay, on your diabetes before and after use of cannabis through a period of time, you'll be surprised. And the same is for blood pressure.
Mm-hmm. I actually have a perfect example. I had a patient with utilizing Adderall for their ADD, but they, at a certain point, started having rheumatoid, all these autoimmune disorders, and it was just something was happening. They came off the Adderall, but it was difficult to come off the Adderall, but being able to utilize cannabis, and then being able to come clean it, all the autoimmune disappeared. It just went away. Just with Adderall, this medicine.
It's what your mental health does to you. We don't understand it fully, but obviously stress, anxiety cause an imbalance of your immune system. You know, it will take time for us to understand that better. And I don't think, I do believe actually it's going to be through the understanding of how quantum mechanics and quantum entanglement works in our physical system. And it will take a while for us to understand fully that. But really, bad energy can give you bad things for you, you know?
Yeah, definitely. But I think all in all, even with cannabis, because you do have the psychedelic effects with cannabis, you can go into a meditation, like you were saying with microdosing, which still isn't legal here, but I know my listeners out there are probably, exploring and working with, obtaining their own microdoses. So it's important to, learn and educate yourself with like microdosing, especially combining with the cannabis. Do you educate your patients on specific like dosing to be careful for? Because when you're adding all these multiple, meds.
For what? For people.
Because you had mentioned doing cannabis along with
mushrooms.
Mm-hmm. Yeah, you had mentioned a patient doing both and then having.
Yeah, we talk, for people, I'm open to answer questions. I'm reading more. Okay. First of all, you got to be careful what you do and where you're getting yourself.
So careful. So
but
careful.
You can get poison like easy, and you don't know your risk factors, The other thing is people who have schizoaffective disorders, who are taking drugs like Cymbalta, schizophrenia. It's very dangerous because nothing's going to happen, and people will try to do more, and, it can end up being a mess. But my recommendation is the following: go slow and start slow, and you don't need every day. Understand? In a few days a week or maybe once a week. It's a very deep experience. It has a lot of GI side effects related to that too.
Which what is it you're saying? Psilocybin.
Psilocybin works through your muscarine receptors in your GI tract, and those receptors are cholinergic receptors. So you can have a big cholinergic response, and that's where comes the nausea, the vomiting, diarrhea, constipation, the whole shebang. People have to be aware they will go through it, and if they have a clean diet, it probably can help. Prior to it.
Yeah, that's what we've discussed on previous episodes on just preparing your body. Nutrition is very important, but also for everybody out there, cholinergic system would be your parasympathetic, the rest and digest. And when you stimulate the cholinergic, you're stimulating the digestive tract of the digestion part of the rest and digest parasympathetic. So that's something that you would get an effect with the psilocybin. With the cannabis, you obviously wouldn't necessarily get that. Do you find that, like you said, the clean diet, that definitely helps too, the GI?
Yeah, if they prepare the GI side tract, they might have a better choice. But some people do it, some people don't. Some people get used to it, but it's something that people should be aware.
Yes, yeah, so they can prepare. And I mean, the key and the most important part, and as we're talking here, is the integration and preparation. Whatever you're going to do, you want to, like you said, start low dose, start slow, and work through that. And then just always have support, have somebody there that is not on any medicine, whether it's cannabis, because you can have a psychedelic effect, go into a meditative state and have very therapeutic meditation and healing in that realm. But even with ketamine, there are clinics, not like ours, that you'll come in and just receive the infusion. And it could be a beautiful clinic, very safe and amazing people. But if you don't have that support, that integration support, that is the most important outside of the medicine, because you have to process what comes out. Things will come out in psychedelics, ketamine, yes, psilocybin, DMT, all, ayahuasca, every psychedelic, there will be aspects of your subconscious mind that becomes exposed, right? And with your patients, do you require them to have integration? Do you provide integration in office, or is that something that they work with their therapists?
What I'd like to, what my goal is to integrate them with their own therapist. Okay,
Hmm.
some patients bring their therapist to the clinic, but I don't think that the biggest value at the infusion is actually dissociation. Okay, you have good
Exactly. Yes.
music. Okay, like a good psychedelic music, a good trance, and a good trip. People have to realize, doctors in the 21st centuries, they have to realize that a trip is therapeutic at a times. Okay. So after you have that, you create your neuroplasticity. Yeah, boom, jump, go to your therapist. But, therapist making questions and guiding you through, the trip, it takes the purpose of the whole thing.
Right. Yeah. During the actual infusion, I tell them not to. Like you can have
Yeah.
a therapist there, but that would be for afterwards, maybe. But not even then. Afterwards, you're kind of still out of it.
Yeah.
Really,
I mean,
ideally, it's
20
the
minutes, an
20.
hour inside the
Yeah.
office, just tripping, and you have to let them do it.
Yeah. Yeah. There's no conversations being had at that point. And that's what we
Exactly.
want. There's some clinics that even will sedate the patient so they don't experience the ketamine dissociation. And I think that's a total disservice, which is
Yeah,
if you want
what
to.
I saw, yeah, some people give it to me dazzle, and I said, why? You know what I mean?
Right, that it competes with the
Yeah.
ketamine. So you're also blocking some of the benefits that you have because there is activity on the GABA receptors, which is where the benzodiazepines work. So,
Of course.
you know, we don't know all the things when you're adding medications that blocks it. Like I actually know, like for any of you listeners out there, if you're ever considering ketamine treatment, any type of stimulant, if you're on ADHD medications, even coffee, I've had patients that they're doing beautifully. They accidentally either take their Adderall that day for a maintenance infusion or have a ton of coffee. The stimulation actually blocks their experience, their dissociation. And then they wonder, oh, the medicine's not working, something's wrong. So you really want less on your system during
Less is better, for sure.
Yes,
I
definitely.
saw I saw in Europe, in Portugal, I met an anesthesiologist that she was doing ketofol. Okay,
Oh,
ketamine
why?
propofol, and it was interesting actually. So and
I can see for the pain patients, for pain, or is it also for mental health?
he said the most she did for mental health, but also post-op patients in pain, like trauma, neurosurgery, things on the nature, spinal. And they used to do it. She's coming with a publication right now. It's pretty interesting. You ever heard about it or?
Because I do anesthesia as my primary profession. I definitely use ketofol as my sedation for longer sedation cases. But for mental health, I mean, I do give actually during anesthesia, I will give if my patients have depression or anxiety or any type of mental health PTSD. I'm like, you're going to get extra ketamine today, versus my like 100% of my patients will receive ketamine because it is such an amazing anesthetic and adjunct. You don't need as much opioids.
I did appendectomy. They did on me on ketamine.
Are you serious? Oh my gosh. Oh, beautiful dreams. I'm sure you had. You weren't even in that room.
The craziest dream. They said I saw the entire operating room inside the dark side of the moon of Pink Floyd Prisma just going.
Oh my God. Wow. That is amazing. That is so interesting. Yeah. That's, and I use it in obstetrics too, for C-sections and stuff with the ketamine.
Yeah.
It's amazing and it's so safe,
Yeah, I did a lot of yard too, emergency room,
Okay.
and then we used a lot. We used a lot in trauma, and it's safe. I mean, you have a guy a drunk guy with a head trauma that you need to place in a CT scan. He's not gonna stand still, and go this here and then boom. We used to do it, and then he was smooth,
Yeah, pediatrics and
the ketamine more and more. I said, Jesus, this thing is great,
Yeah. No, what I would love to see is patients coming in mental health crisis that are going to Baker Act themselves, for suicidal ideation or, the depression. I would love to see them receive an infusion. In the ER, they could receive it. Imagine.
They do the ER, but they're not trained yet,
Right.
They need more training. And that's what we're doing in South America, in Peru right now. We had an organization there. It's a nonprofit, Neuromedici of Peru is a nonprofit where we are basically educating doctors across the border. I mean, I just came back. I was able to have a psychiatrist open ketamine clinic in Arequipa. Arequipa in Cajamarca, north of Peru. And he's a pretty amazing guy. He's doing works with DMT, actually, and he has a publication. He's coming with a publication right now, and I need to introduce him to you because he's...
Oh, I would love that.
He's doing DMT office space, DMT in the jungle. And he's comparing the results of the patients. And he's going to prove to us that is the jungle. When you do ayahuasca, DMT, you have to be close to nature, tree, land, universe, And there's a huge impact on clinical response. He told me, listen, we're using a way less therapy for those guys who are in the jungle than the ones in the clinic, because you wake up in the clinic, you're in the street, they have cars, they have traffic, you're back to your mode, your mojo that triggers your PTSD,
Well, I 100% agree with that. I understand that, yes, in nature, you're going to have always a better response, just being grounded and being one with the earth, because we aren't in that space here in the United States and most of the modern world. But not every patient's going to go to the mountains of Peru or DMT in a forest. Some people want that safety, the cocoon of a clinic that somebody's monitoring them. People, and that's why I feel, and I know I've said this multiple times, sorry out there if you're listening, but it's so important. There are so many people out there to help everyone, and people aren't going to go into the jungle, but it's something that once it's legalized that I will want to offer, because, they have to receive it somewhere. If they aren't going to go into the jungles, where are they going to feel safe? And that's the care that I can provide and that you can provide in a clinic. Obviously we can't move our clinic into a forest, right? Patients want to be monitored. They want to know that they're safe so that they can really go deep, and just really be in their space, So there's always people to help in every area of the field. So we're the clinical field, and then we have people out in the forest and the nature and the grounding. That's where our ancestors, everybody's doing the research now and the scientifics, but we already have ancestors that have been studying this medicine and mastering the medicine. The medicine.
Listen, if we go through the Bible, you and me are going to tell you a lot of trips over there is probably something.
Oh, yeah.
That's in every religion.
In every religion, yes.
Yeah. I mean, the Amazon forest, so far, they have about 80 trees that are already cataloged with DMT. So you think what is in the rest,
Yeah, it's beautiful. The potential is endless. So, yeah, it's beautiful. Thank you so much, Dr. Consalter. Thank you so much for joining me.
It was very nice, very smooth, and it's always better when you talk with passion, freely. You know what I mean? We're just starting. We are just touching the tip of iceberg of psychedelic medicine. So, and I'm here to support.
And we're the facilitators of being able to do it. We're joining the Eastern and Western medicine, and then our ancestors, the indigenous tribes, and all the hard work that they've done in passing down. If it wasn't for them carrying on this culture, who knows where we would have ended up.
Yeah, well, I always finish with whenever I teach people a lecture, or I'm part of a lecture, like you and me are part of something right now. We learned in medical school, we were like bipeds, okay? Mind and your physical health, okay? With psychedelic medicine, you understand you are part of a three-thing here. It's your mind, your physical health, and your spirit. If you don't treat those three all together, man,
yes,
forget it.
No, 100%. And that's where in our world now, where we're stuck and we have this mental health crisis because we've lost that spirit. And I'm not religious in any way, so I know people
a long time ago.
Yeah, but it's not about religion. It's about your spirit, your soul, your energy, who you are internally outside of your body, and the physical. So that's what psychedelics really connect. I feel, in the mental health, we need connection. And psychedelics brings that. So it's a beautiful thing, and you're part of it, and I'm part of it, and I love it. I love it. Thank you so much for all your work.
Thank you so much. Thank you guys for the chance, the opportunity, and love you. Best of luck. We'll be with you guys soon whenever you guys call me. Okay?
Oh, definitely. Thank you. Thank you, everyone out there, for joining us for this week's episode of Psychedelic Healing. Have a beautiful night.